Welcome to the Raise Your Banner podcast, where we provide a safe, all inclusive space to discuss mental health topics and our journey with mental health. Today, we'll be discussing selective serotonin reuptake inhibitors, or SSRIs, and non SSRIs. We will discuss the differences of both, how they can help us along our mental health journey, and some of their side effects. Stick around and enjoy the episode.
3, 2, 1, 0.
Good evening. It's your host, Josh, and welcome to the podcast. And like I said before, we're going to talk about the differences between SSRIs and non SSRIs. While these medications can be life changing for some, it is very important to understand how they work so we can all make key and informed choices regarding our mental health journey. Let's start with SSRIs, or selective serotonin reuptake inhibitors. They're commonly prescribed for depression, anxiety, and other mood disorders. Medications like Prozac, Zoloft, and Lexapro fall into this category. SSRIs work by increasing serotonin levels in the brain. Serotonin is a neurotransmitter that helps regulate mood, sleep, and emotions. By blocking the reabsorption or reuptake of the serotonin, these drugs keep more of it available in your brain, which can improve mood and reduce anxiety. They're also often the first choice for treatment because they tend to have fewer side effects than older antidepressants. But they are not the only option out there. That's where non-SSRIs come in. Non-SSRIs include a range of medications that affect different neurotransmitters. For example, serotonin norepinephrine reuptake inhibitors like Effexor and Cymbalta impact both serotonin and norepinephrine, another chemical tied to mood and energy levels. Then there are some atypical antidepressants like Wellbutrin, which primarily affects dopamine and norepinephrine, and TCSA's tricyclic antidepressants, which influence serotonin and norepinephrine, but tend to have more side effects. So why might someone choose a non-SSRI over an SSRI? It really depends on the individual. If someone doesn't respond well to SSRIs or experiences side effects like sexual dysfunction or weight gain, a doctor might recommend trying a different class of medication. For people with specific symptoms like low energy or chronic pain, an SNRI or atypical antidepressant might be a better fit. It's really all about personalizing treatment to match the unique needs of each individual. It's really important to work closely with a healthcare provider to find the right medication and dosage. Antidepressants can take time to work, and sometimes it's a process of trial and adjustment. The real key takeaway, SSRIs and non-SSRIs are both valuable tools for mental health, but they work differently and have a distinct benefit and drawback. Knowing the basics can help you have a more informed conversation with your doctor. Now let's get into more specific medications for both. Let's talk SSRIs first. Selective serotonin reuptake inhibitors are a class of medication commonly used to treat depression and anxiety. One of the most common known SSRI drugs is called sertraline or Zoloft. It's used to treat social anxiety, depression, panic disorder, PTSD, and OCD. It's typically well tolerated by many people and has a lot of flexible dosing options. It can also cause nausea, diarrhea, or sexual dysfunction for some users. Another SSRI is paroxetine or Paxil. It's specifically approved for social anxiety disorder as well as depression, panic disorder, and general anxiety. It's really effective for severe anxiety symptoms, but it can cause weight gain, drowsiness, and withdrawal symptoms if stopped abruptly. Another you've probably all heard of is called Prozac or fluoxetine. It's also used to treat depression, OCD, panic disorder, and sometimes social anxiety. It has a long half-life, so missing a dose is less problematic, but it can also cause restlessness, insomnia, especially at the start of treatment. And a fourth is exacalparum or Lexapro. It's really effective for general anxiety disorder and depression, and sometimes used as an off-label for social anxiety. It has fewer side effects compared to some other SSRIs, but it can also cause headaches, fatigue, or dizziness. These are just a few examples of the SSRIs out there. SSRIs usually take a few weeks to start working, and finding the right medication and dosage often involves some trial and error under a doctor's supervision. Side effects often improve over time, but it's very important to communicate with a healthcare provider about any concerns that you might have. Now let's talk about SNRIs. These medications increase both serotonin and norepinephrine levels, which can help regulate mood and anxiety. The first one we'll discuss is flunaxafine or Effexor. It's used for general anxiety, social anxiety, and depression. It's pretty effective for both mood and physical symptoms of anxiety. It can cause increased blood pressure, nausea, or withdrawal symptoms if stopped suddenly. Another common non-SSRI is duloxetine or Cymbalta. It's used for anxiety, depression, chronic pain conditions. It helps with both emotional and physical symptoms of anxiety. Again, though, it can also cause fatigue, dry mouth, or sweating. Now let's talk benzodiazepines. These are very fast-acting drugs that can calm the nervous system and are typically used for short-term relief or situational anxiety. One of the most common ones is called Xanax or alprazolam. It's used for panic attacks and acute anxiety. It's a quick relief of severe symptoms type drug. It can be very addictive, it can cause drowsiness, and it is not ideal for long-term use. Another would be clonazepam or Klonopin. It's also used for social anxiety and panic disorder. It has a little bit longer lasting effects than Xanax, but it can have a risk of dependence and sedation. Another non-SSRI are called beta blockers. These medications don't directly affect mood, but help manage physical symptoms of anxiety. One we could discuss is proparapanol, or otherwise known as Andorol. It's used for performance anxiety. It helps with physical symptoms like a racing heart or trembling hands. It's effective for situational anxiety without affecting cognition, and it really doesn't address emotional symptoms for anxiety. There are multiple atypical antidepressants out there as well. These drugs can work on various neurotransmitters in unique ways. Kind of the first well-known one is bupropion or Wellbutrin. It's used for depression and sometimes anxiety, though it's not a first-line drug for social anxiety. It's less likely to cause sexual side effects or weight gain, but it can also increase your anxiety or insomnia in some people. And the second is mirtazapine or Remeron. It's also used for depression, anxiety, and insomnia. It does help with sleep and appetite, but it can also cause sedation and weight gain. At this point, I'd really like to share a little bit of my personal journey using SSRIs and non-SSRIs. Like I said earlier, it can really take a long time to dial these things in, and it's really important that you work with your psychologist and then your prescribing psychiatrist or whatever provider you use to get the right fit. It probably took me well over a year across at least 6, 8, 12 different drugs to get things dialed in. You know, each drug, while most of them did work for the anxiety, the side effects were typically unbearable or just caused more stress and heartache than the drug saved me from with the anxiety. So you know, after working all through these trial and error periods and figuring the dosage, figuring what drug worked the best, for me, I did finally settle on one that's maybe a little less known than others, called Prestique, and I've been on that ever since, and it seems to really control the anxiety and really not have a ton of side effects. But like I said, I would tell anybody out there, you know, the biggest part is listen to your body, listen to your provider, be patient. As much as we all want the anxiety to be, switched off and to live a better life, it does take some time and it does take a little bit of work, and it's not going to happen overnight when we're talking about trying to dial in the use of drugs for our mental health journey. So if you're considering a medication or struggling with your current treatment, really don't hesitate to seek professional advice. Mental health is a journey, and finding that right support can make all the difference. As always, thank you so much for tuning in, and remember, you're not alone in this journey. There are resources and support available to help you manage your mental health journey. Until next time, take care and stick around. Thank you for listening to today's episode. Remember, raise your banner if you're somebody can turn to in a time of need, or raise your banner if you just need help. And please remember, you're not alone. There are resources out there, whether national hotlines, local hotlines, friends, family, or professionals. They are out there. The Raise Your Banner podcast is produced by the Raise Your Banner Foundation in conjunction with research conducted by Matrixa Research Group, and your host is Josh Robichaud. Artwork is from the talented Jenna Bordinger, and music is by the talented Josiah DJ Slowbro Renton.